Hey guys, you're probably here because you want to know all about migraines, why we get them, who gets them, treatments, and loads more. Well, I want to answer that question along with many other questions in this week's Responding to Your Comments, where we look at fun questions, we look at science-based questions, but most importantly, we always look at the evidence. Ritesh M. Make a video on migraines. I have a lot of problems with it, please. Ritesh, thank you for your comment. This was a comment from a story that I did, and of course, I'm going to try my best to help you. This is going to be quite a long video. We're going to look at the causes of migraines, we're going to look at treatments, we're going to look at when you should seek medical attention, and loads more. So what I'm going to do is I'm going to leave a chapter sort of breakdown in the description below so you can look at it at any point whilst I'm talking in the video. If you want to find any specific information, there's a breakdown there, so feel free to use it. Okay, so let's begin with the common symptoms of a migraine. So it's usually an intense headache on one side of the head, typically on the front of the head, but it can be on both sides, or it can start on one side and spread to both sides. The pain is usually a moderate or severe throbbing sensation, and it gets worse as we move, which is why it's so debilitating having a migraine, because it stops you from doing all your normal activities. Now, in addition to these, you may also experience other symptoms like feeling sick, having an increased sensitivity to sounds and lights, sweating, having poor concentration. By the way, this list goes on, so what I'm going to do is I'm going to leave a full list in the description below. In fact, there's going to be loads more information about everything that we speak about in the description below too. Now, an important fact for you to remember is that yes, some people may get these additional symptoms that we just spoke about with their headache, but some people may not even get a headache. They might just get the additional symptoms that we just spoke about with their migraine. So what I'm trying to say is we're all different, everyone's different, and everyone reacts differently and has different symptoms with their migraines. The symptoms of a migraine can last between 4 hours and 3 days, and you may feel really tired and shattered for up to a week afterwards. So if you're not someone who suffers from migraines and you're now learning about it, I hope you realize just how debilitating they can be. Now, 1 in 3 people with migraines have a temporary warning symptom known as an aura before a migraine. They develop over 5 minutes and last up to an hour. Now, the symptoms of an aura are different for each individual. Some people experience visual symptoms such as blind spots, flashing lights, and other people experience symptoms like pins and needles and loads more. The list is quite vast, so once again, I'm going to leave loads more information about it in the description below. So we now know about the symptoms of a migraine, we know about auras, but what causes the migraine? Well, the exact science is actually unknown, but it's thought to be a result of abnormal brain activity which affects the nerve signals, blood vessels, and chemicals within the brain. So it's not quite clear what's causing this abnormal brain activity, but it's thought that our genes can make us more susceptible to migraines from triggers, and there's loads of different triggers that can potentially cause migraines, from hormonal to emotional to dietary to environmental to medicinal. There's loads of different causes, and if we go through all of them right now, we're going to be here till tomorrow. So once again, I'm going to leave more of the causes and triggers in the description below for you. Now let's move on to treatments. There's currently no cure for migraines, but we do have treatments for symptomatic relief of them. And what I mean by there's no cure for migraines is, let me give you an example. Let's say, for example, you have a bacterial respiratory tract infection and you get prescribed antibiotics, and then the antibiotics kill the bacteria, so you're cured. So with migraines, we don't have that cure, and instead we have symptomatic relief, which is why it can take some time to find out the best treatment for you. So it might need one treatment, it might need a combination to give you the best symptomatic relief. So let's work through it step by step, and please remember, certain techniques may work for you and they may not work for others, and vice versa, because migraines are quite unique to the individual. So I guess it all comes down to a bit of trial and error. Now, at the start of a migraine attack, the best thing that you can do is either go to sleep or lie down in a quiet, darkened room. This is one of the best things that you can do at the start of an attack, but I do appreciate this is quite idealistic because you never know where you're going to be when you're having an attack. You could be at work or you could be at home. So if you're at home, this is a good thing to know. Other people find that eating a little something makes them feel better, and some people find that once they've been sick, they feel much better. Now let's move on to painkillers. Many people who suffer from migraines find symptomatic relief from painkillers that you can get over the counter, for example, paracetamol or ibuprofen. But please remember, before taking any medication, always speak to your pharmacist first so they can check that you're safe and suitable to use that medication, and always read the information leaflet that comes with it. This is one of the most important things that everyone should do. Now, whilst we're on the subject of painkillers, there's 2 things that I want you to remember. One, Take the painkiller as soon as you get those symptoms of a migraine, the ones that we spoke about earlier. As soon as you get your first symptoms of a migraine, you need to take your painkiller. This is going to give it time to absorb and get into your bloodstream and start working. 2, don't wait until it's too late. If you're going to take your painkiller once your migraine symptoms are fully there, it's probably not going to be effective. So we now know that with painkillers, speed is probably one of the most important factors about getting the most symptomatic relief, because it's going to absorb into your bloodstream quicker and it's going to have an effect sooner. Also bear in mind, it might be worth speaking to your healthcare professional about getting soluble medication. Soluble medication actually absorbs faster than a tablet or a capsule will, so it's going to have that onset effect a lot faster. But please bear in mind, soluble medication, well, it tastes really bad. It's also worth mentioning, because I know there will be people watching this video who vomit quite regularly when they have a migraine. Now, if you are one of those people, and if you're taking a painkiller orally and you're throwing up, then that painkiller doesn't have enough time to absorb, so it's not really going to work properly. Now, an option for someone who vomits quite often when they have a migraine would be to get a painkiller in a suppository version. That way you're not really worried about throwing up, because it's still going to absorb. Now, painkillers can be effective, but please remember that taking any painkiller too often can actually make migraines worse. We call this a medication overuse headache. So what I'm going to advise you all to do is to speak to your healthcare professional if you feel like you're having to take your painkillers quite frequently, or if you feel like over-the-counter painkillers just aren't being effective. So I did tell you this is going to be a long video. I hope you're getting on okay with it. Now, let's say, for example, those over-the-counter painkillers or any painkillers you've been prescribed are not helping. You've made that appointment to speak to your healthcare professional. They're going to talk to you about different treatment options. They may talk to you about different treatment options, for example, prescription medication like triptans or antiemetics, anti-sickness tablets basically. So let's quickly run through them and find out a bit more information about them. So let's begin with triptans. These are a specific medication for migraines, and it's thought that they reverse some of the changes in the brain that cause migraines. So for example, if you remember earlier, we said one of these changes was the fact that blood vessels widen around the brain. Now these triptans, it's thought that they constrict these blood vessels. Another option that your healthcare professional may discuss with you are anti-sickness tablets or antiemetics, which we call them in the healthcare world. Now they're very good for symptoms of sickness and vomiting and nausea that you get with migraines, but please remember that these antiemetics can also be useful at treating migraines. So even if you're not getting sickness, the feeling of sickness or nausea or anything like that, they can actually be quite useful for the other symptoms of migraines as well. So it's useful for you to know that. But please, once again, remember, you will have to discuss all of these with your healthcare professional, and always remember to read the information leaflet that comes with any medication and speak to your pharmacist or your doctor to check that it's safe and suitable to use any of these. Combination medicines are also another option to discuss. Certain combination medicines can be purchased from your pharmacy once you've had a chat with your pharmacist. They usually contain things like a painkiller and an anti-sickness. I do think combination medicines do have a convenience factor because they're a lot easier to take, but there are a lot of products out there, so it's really important that you speak to your pharmacist so they can check your symptoms and recommend the best product for you, and also make sure once again that you're safe and suitable to take that medicine. And like I always say with any medicine, always read the information leaflet that comes with it. I am really talking a lot in today's video, but this is a really big topic and I'm trying my best to summarize it to the best of my ability for you. Now let's move on to complications, which is probably one of the most important parts of this video, and I really want you to try and remember as much as you can from it. Okay, so I think the best way for me to give you this information is to just list through them. So let's begin. If you're having migraines for more than 5 days a month, you need to speak to your healthcare professional and get those symptoms reviewed. Also, even if your symptoms are being controlled with medicines, you still need to make an appointment with your healthcare professional and get the migraines reviewed. Migraines are also associated with a small increased risk of ischemic strokes. So this means if you have any of the following symptoms, you need to call an ambulance straight away. Paralysis or weakness in one or both arms or one side of the face, slurred or garbled speech, a sudden agonizing headache resulting in pain which is so severe that you've never experienced before, a headache along with a high temperature, stiff neck, mental confusion, seizures, double vision and a rash. These symptoms can be a sign of something much more serious like a stroke that I've just mentioned, or even meningitis. So it's very important that you remember them, and if they ever happen, if you ever get any of these symptoms, you need to dial for an ambulance straight away and get emergency help. I will also leave loads more information about these in the description below, so please read them and please remember them. Thank you for your comment, Ritesh. I really hope this information helps you and it helps anyone else who's watching. I did also make a video not long ago all about how to prevent headaches and migraines and some really useful tips on there. So if you haven't seen that video, I will leave a link to it up here and in the description below. And if you have any of your own tips on how to treat a migraine and what helps it, please leave a comment below too, because I'd love to read it and I'm sure everyone else watching this video would too. Now, usually in responding to comments, we would now go on to the next comment, but I feel like this video is going to be so long, and to be quite honest with you, I'm so tired now after this video. I've just had to change the battery as well. So we're gonna stop it there. If I didn't get back to your comment, if I didn't get back to your question, I'm really sorry. Leave another comment and I will try my best to get back to you in a future episode of responding to your comments. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.